Good evening, everyone. My name is Liam Moore. I'm a staff member at the American Brain Foundation. I want to welcome you all this evening for Childhood and Autism with Dr. Yolanda Holler-Managan and Dr. Rujuta Wilson. Our host for the evening is Ralph Leslie. Ralph Leslie is Executive Vice President, Chief Operating Officer, and Chief Financial Officer at the Pew Charitable Trusts. Previously, he was the Chief Financial Officer and Associate Dean of Finance and Business Operations at Northwestern University's Weinberg College of Arts and Sciences. Before that, he served as Chief Financial Officer and Treasurer of the Obama Foundation. He has more than 30 years of experience in accounting, finance, and strategy in senior roles at organizations such as Navy Pier Inc., the Ounce of Prevention Fund, PepsiCo, and Cargill Inc. He currently sits on the American Brain Foundation board. Ralph, thank you for being here, and please take it away.
Well, thank you, Liam. First of all, welcome all, and thank you for joining us this evening. In addition to being a proud member of the Board of Directors of the American Brain Foundation, I also have the privilege of serving as Vice Chair of the Board of Directors for Easter Seals of Metropolitan Chicago, an organization doing great work in support of individuals and families impacted by autism. So this topic is not only important, but to me, it's personal. Tonight, we'll learn about childhood and autism, including the early signs of autism, therapeutic approaches for supporting children on the autism spectrum, advocating for individuals with autism, and navigating the transition to adulthood. Webinars like this one tonight are opportunities to connect with experts in various topics of interest around the brain and neurological care. I invite you to put your questions in the chat at any time. After the presentation, we will try to address as many questions as we can in our Q&A session. The American Brain Foundation funds research across the whole brain, knowing that brain diseases, disorders, and injuries are interconnected. ABF cannot exist without support from donors. So if you are so moved, here comes the ask now, please make a donation so that we can continue funding critical research and continue to host free webinars like tonight's event. You can give at American Brain Foundation, one word, .org/donate or scan the QR code. Thanks to a very generous donor, every gift you make until the end of the year will be matched. So let's move on into our topic of conversation, childhood and autism, with our esteemed panelist. I am pleased that we have with us today Dr. Yolanda Holler-Managan, Associate Professor of Pediatrics in the practice of Neurology at Northwestern University's Feinberg School of Medicine. Go Cats. Dr. Rujuta Wilson, Assistant Professor of Pediatric Neurology and Psychiatry, Director of Research of the UCLA University Center for Excellence in Developmental Disabilities at the UCLA David Geffen School of Medicine. So thank you, Dr. Holler and Dr. Wilson, for joining us tonight.
Thank you very much
for having us.
Yeah.
So let's get this started. Let's start the panel discussion, if you don't mind, by having each of you just briefly introduce yourselves and how autism relates to your work. Dr. Holler, would you like to go first?
Sure. I have been practicing for over 20 years and primarily take care of children with developmental disabilities. I also have a son with autism, so this is near and dear to my heart, and I wanted to share my experience with that as well.
Thank you. Dr. Wilson.
Yes. So I'm a pediatric neurologist trained in neurodevelopmental disabilities. And so autism, developmental disabilities, is a part of what I do every single day here at work. I'm both a clinician, so I see patients in the clinic with autism, making early diagnoses, managing co-occurring conditions, and I'm a clinical researcher. So I see many children with autism in my clinical research program, studying different things like the early signs of autism, children with genetic conditions and autism, and evaluating the way different movement programs can benefit autistic children.
Well, thank you both for those great introductions. And again, we are so happy to have you. So let's get into some questions. I will direct certain questions to each of you, but feel free to redirect to each other as appropriate. let's start with kind of definitions and early signs of autism. So, Dr. Wilson, can you explain to us how we define autism spectrum disorder?
Yes. So that's a good question. And I think, some of that has changed over time, although it's been, somewhat more consistent in about the last 10 years. So right now we know it as autism spectrum disorder. It's one term. I'll just quickly sort of comment on this, that prior to that in 2013, we used to have autism, Asperger's condition, and pervasive developmental disorder. Around 2013, when we had something called the DSM-5, our diagnostic manual updated, it now all falls under autism. And I mention that I think it's important because I often see some older individuals who had an Asperger's diagnosis, and understandably that can be a little bit confusing now that we've moved over to an all umbrella sort of an autism diagnosis. An autism diagnosis, when we come to a clinical diagnostic categories or how we define it, is really based on two categories. And the terminology that I'm using comes from our diagnostic manual. And I want to be mindful right off the bat here for everybody that's joining that just in terms of terminology around disorder, deficits, co-occurring conditions, person first versus identity first, really both Dr. Holler and I and our entire team aim to be respectful of everyone and all preferences, but do know as a part of this medical discussion, I'm sure we'll be using both of that terminology as well. So from the DSM, the first sort of category is social communication deficits or impairments or difficulties. So we think about things like difficulty forming and maintaining relationships, difficulty with understanding nonverbal communication or social emotional reciprocity, for example. And the other category that we have, big one, is repetitive behaviors and restricted interests. So within there, maybe some more commonly thing that people tend to think about are repetitive motor movements, right? Flapping hands, spinning, but also repetitive play with certain objects, repetitive use of certain phrases, more restricted interest around certain areas, difficulty transitioning from those restricted interests. A newer one that was also added for the DSM-5 is hypo or hypersensory responsiveness. So either difficulty with loud sounds, certain textures, or maybe more sensory seeking. And it's off of those main diagnostic criteria that we make autism diagnoses. But we also think about things like expressive language level, whether or not it's presenting with intellectual disability, and level of adaptive functioning. So those are some of the main definitions when you're thinking about an autism diagnosis. And I'll kind of round out by just saying, these are the diagnostic criteria, but we recognize that autism is a very heterogeneous condition. Kids, adults, those who present, all can present very, very differently. So that's why within these diagnostic criteria, there's of course other things that we're thinking about for each individual as well.
So, Dr. Wilson, how is autism related to other neurodevelopmental disorders such as ADHD? Is there a connection? Is there a relationship?
Yeah, that's a good question. So what we know is that autistic individuals, those who have a diagnosis, we see really high rates of other neurodevelopmental disorders or diagnoses in those who have autism. So ADHD, for example, attention deficit hyperactivity disorder, it's sort of noted that up to 30 to 50% of individuals with autism can also have ADHD. That also goes for other kind of neuropsychiatric or neurodevelopmental conditions, intellectual disability, anxiety, depression. These often occur at higher rates in autistic individuals. And there are, from the research side, a lot of studies looking into why that could be the case developmentally or neurobiologically. But clinically, we know that there's a big association between autism and those other developmental disabilities.
Thank you. Now, Dr. Wilson, you touched on some of the earliest signs of autism. Dr. Holler, how do those signs typically differ? Do they typically differ between boys and girls?
Well, I think when the studies were first done, they were primarily describing boys. So girls can present a little bit differently. Girls are typically more social beings, so you may not see as much in terms of social deficits that you will see in terms of boys. You may also not see as much language delay. Girls tend to speak and have words or vocabulary words earlier than boys, so that presentation may be a little bit different. Also, girls tend to do what's called masking or camouflaging, which occurs more frequently in girls rather than boys. And what that is that girls tend to want to appear to be as social and as, I would say, neurotypically normal as possible instead of neurodivergent, because of just the socialization and just living in the world. So clinically, we may see that some girls may not have as many social deficits as boys.
And so, and either one of you, feel free to jump in here. Why is early diagnosis so critical, and what steps should parents take if they suspect their child may be on the autism spectrum?
Well, I would say as a parent, the first thing that you should do is talk to your pediatrician. Pediatricians are great at picking up deficits or differences in your child's behavior and development. During the routine clinical visits, they will give you tests or that you can fill out in terms of an ASQ or MCHAT that will discuss any type of differences in your child's development, language, social skills, motor skills. And so if you notice those things, it'll be great to bring that up to the pediatrician, as I did with my own son.
I'll just, I'll add to that, or kind of extend Ralph some brought up, and I agree completely with Dr. Holler, is that really bringing up to your pediatrician that you do have concerns, and knowing that it's recommended by the American Academy of Pediatrics to do autism-specific screening in the pediatric visit by 18 months of age. But if you have concerns before that, we know there are even earlier signs, right? Not consistently responding to one's name, this sort of lack of kind of consistent or appropriate eye contact or sort of positive affect sharing. If you're seeing some of those things before 18 months, going to your pediatrician, bringing up those concerns is very important. And we know that early intervention really does improve longer neurodevelopmental outcomes. So we know the earlier you get into things like ABA therapy, if that's right for your child, speech therapy, occupational and physical therapy, this is really working at a time where the brain is learning a lot. The brain is taking in different things from its social environment. And those early interventions are very important for language, communication development, I should say, for behavioral strategies, and for other adaptive function skills, which are very important as well.
So thank you both. And so now that we've talked about the importance of early diagnosis, let's get into kind of therapies and research. And Dr. Wilson, I'll start with you. What are the most effective therapeutic approaches for supporting children with autism spectrum disorder?
Yeah. So I think with that, it's a very good question. Of course, a lot of questions that parents have. And I'll kind of start again by saying, with the caveat, that each child or adult or individuals that diagnosed with autism deserve sort of their own evaluation to understand what's most effective for them, right? So not maybe all of the therapies are the right fit for all children, but taking into account what we most traditionally sort of think of is that some of the therapies, at least that have been studied to shown an effectiveness, is one particular one is ABA therapy, or applied behavioral analysis therapy. Now, this therapy has really been focused on being able to sort of improve or promote adaptive function, behavioral engagement, maybe reduce sort of behaviors that lead to more difficulty functioning in your day-to-day environment or lead to more behavioral difficulties or dysregulation. That's not always the right one for the right person at the right age, right? But when we traditionally think about when a child is first diagnosed at a young age, there is good evidence to show that ABA can be beneficial. Other therapies that we think about, not all children with autism have speech delays or speech difficulties, but it's quite common to not necessarily have speech delays, but pragmatic speech difficulties, social communication difficulties. So speech therapy is often one that we use. Occupational and physical therapy, because movement problems, not just motor delays, but how a child moves, coordination, balance are also very prevalent and very important, not only for adaptive functioning, but sort of how you engage with the world in general. So occupational and physical therapy are ones that have been studied. And then another that I'll note in terms of other sort of effective interventions that have been studied are things like social skills therapy. So, for example, there's therapies like peers programs or other social skills programs that can have a lot of benefit for autistic individuals. And I'll just make a note, I think, in the line of ABA therapy. One thing that could be a misconception sometimes is that ABA therapy is just one type, right, of therapy. And I think what's important to know is that there are different, ABA is the umbrella sort of term, and there are therapies that are more naturalistic and others that are a little bit less naturalistic and play-based. And I think when considering that for your child or for the individual you're caring for with autism, it's good to talk to those providers to get a sense what route might be the best for that individual.
Thank you. So, Dr. Holler, just to go a little deeper on some of the therapies that Dr. Wilson just mentioned, how can those therapies be tailored to meet the individual needs of children with different levels of functioning on the spectrum?
In talking with patients and families, and even my own experience, I think every child has to be treated differently. So if your child has significant difficulty with expressive language, either they do not have verbal words, or they don't point, or they're not able to communicate, then speech therapy is definitely something that is needed. And in speech therapy, the speech therapist can discuss on ways to help your child, either through using alternative ways to communicate, like an AAC device. For example, my son had an AAC device in which it was like an iPad that he was able to use to communicate. He was able to point at words and communicate in that fashion. So that can be an option for children. So younger kids may learn sign language, may do other ways to communicate, like a picture exchange or things like that. So that is very important, because people who do not communicate can get awfully frustrated. And sometimes that will increase the risk of behavioral problems that can then present. Other things that can be very helpful is occupational therapy that can help emotional dysregulation. Some kids get very anxious and upset, and they need help with sensory issues, and that can be very helpful. Some kids like to have more sensory input. They like to jump, and they like to crash into things, or they don't like sensory input. They may need headphones or things like that to help with hearing issues. So those things can be helpful with OT. Some kids can even have co-occurring conditions such as apraxia. My son has that. He has difficulty being able to dress himself. Now that's a lot better with therapies, but those are things that sometimes may not present at that time. You may not understand what's happening until later on, when a child is going to school and they have difficulty with those activities of daily living.
And so what role does early intervention play in the long-term development of a child with autism?
It's so very important. We know that studies that children who receive these interventions have great improvement in their expressive and receptive language, their fine motor skills, gross motor skills, cognitive development. So it's very important to start those things early. As was mentioned by Dr. Wilson, some children do receive ABA. Does every child need 40 hours of ABA? No. So that should be tailored for every child to figure out what is the best for that child and the family.
Thank you. So let's look into the future. Dr. Wilson, what does the future hold for personalized medicine? And can you tell us about some of the research your lab is conducting at UCLA?
Yeah, definitely. I think the future is really bright in autism. I think there is a lot that we know now that we didn't know 5 years ago, 3 years ago, 10 years ago. I still think there's a lot we need to learn, but there are a lot of avenues of research occurring within autism. I think some of the very exciting work that is allowing us to start understanding, causes of autism, for example, or different pathways, are genetics research in autism. We're starting to understand that there are quite a few genetic conditions, or up to 25% of kids with autism have a known genetic diagnosis. We've known for some time that autism is very highly heritable, we call it. So by that meaning studies of infants who have a sibling with autism, finding that they have a higher likelihood of receiving an autism diagnosis, up to 20%. Studies of twins with autism, so identical twins having rates of about 80 to 90% of both the individuals having autism. And that's really led us to understand more about the genetic architecture of autism. And we're starting to get to a point where not just studying genetic conditions, but genetics within autism, starting to understand, are there certain pathways that can affect certain aspects of the brain that are more likely in autistic individuals compared to individuals without autism? I think other aspects of really exciting intervention and research within autism is this recognition. We mentioned earlier in this that there are really high rates of co-occurring psychiatric conditions in autism, right, or neurodevelopmental conditions. But I think for a long time, we didn't recognize as well, or even if we didn't follow it, is that there's also very high rates of other medical conditions, cardiovascular disease, right, obesity, potentially higher rates of other, now we're finding more and more potentially higher rates of other neurologic conditions, like Alzheimer's dementia, for example. And that's starting to kind of tack away at early research that is providing recognition that we need to not only better understand this, but giving information to clinicians to better screen for these things and refer these individuals to the appropriate therapies and treatments really early. I think another aspect I'll touch on within the research world is intervention research, particularly early intervention research. And I think there's some really exciting work of colleagues of mine here at UCLA and throughout the country and the world of understanding what are the most, for really early signs of autism, or for infants who might have a higher likelihood of autism, what are some areas that we might be able to target early, like language, that can really improve long-term outcomes? And I think that is very exciting as well. To touch a little bit about what my lab does here at UCLA, or what my clinical research does. Well, I mentioned a little bit earlier about movement and motor problems. And, I'll just kind of anecdotally tell you, as a child neurologist, when I was in training, certainly before my neurodevelopmental disabilities fellowship in child neurology at the time, we learned about autism. We knew it was there, but really the amount of training that we should receive, knowing that it occurs in many of our patients, wasn't quite there. And when I went into my fellowship, I was really struck as a neurologist that I was trained to diagnose cerebral palsy, right? I was trained that there's a motor problem, here's the brain injury, or I was trained to diagnose a movement disorder or tics. But in so many of my autistic patients, I was finding that they had movement difficulties, delayed motor milestones, difficulties with coordination, with balance. A lot of families would tell me, he or she can run, but they can't tie their shoes or ride a tricycle. And what we found was, and what we know from both other research and our research, is that these really early life motor problems are actually connected to the way you develop language. And they're connected to the way you develop cognition, for example. And another big aspect is that if early in life you're not moving in a way that's the best or most functional, you have difficulty with it, you're more likely to move less or be more sedentary, which can really impact your physical health, right, and your mental well-being. And so what we focus on here in the research is understanding and measuring what those movement difficulties are, because historically we've used really broad terms for them, which makes it hard for doctors to diagnose them or identify them. And then understanding how those movement difficulties relate to autism symptoms, to language outcomes, and to cognitive outcomes. And by doing that, our hope is to better identify these movement disorders, inform clinicians to be able to identify them, and really advocate for early intervention in this area to improve a lot of these broad areas like language development, cognitive development, and physical and mental health and well-being.
Great, thank you. So, we've talked about diagnosis, we talked about therapies, and we talked about research that gives us hope. Let's kind of shift gears here and talk about advocacy for individuals with autism spectrum disorder. And so I'm going to move to Dr. Holler. what are the most common challenges parents and educators face when advocating for a child with autism in school settings? You, as a physician, obviously, had access to a lot more knowledge and information than most parents. But for a typical parent who's not in a medical professional, what are some of those challenges?
Well, I think one of the challenges is that it is hard for sometimes parents to prove that their child may be competent. And I think sometimes as a physician and as a parent, I always tell my patients and their families that you should presume competence. Even if a child does not have language, you have to assume that they're competent until it's proven otherwise. Even with my own son, who had neuropsychological testing at 3.5, I was able to be present for the testing. And at first, his test results had shown that he had an intellectual disability on one part of the test. But the other part showed that he, at 3.5, was academically ready. So he was performing academically at 5. And I was like, well, how can you be intellectually disabled, yet actually be performing at a 5-year-old level at 3.5? That just doesn't make sense. But now we know that a lot of children, autistic children, have scattered skills. So they may be competent in one area, may have a disability in another. So sometimes it's hard for people to quite understand that. And then you have to also figure out, well, then where should they be in a school setting? Should they be in a general education class and then be pulled out for special education? Should they be in special education? So there's all these things that you have to try to figure out to make sure your child is in the correct setting. Because if they're not, then sometimes they have an increase in behavioral problems because either they're anxious if they're in a setting that is too difficult, or they're impulsive because they are bored. So it's this fine line that we have to kind of walk on as a parent. And then, of course, educators want to know exactly how to best educate someone who can have these scattered skills. So those are things you kind of have to talk with school, work during the IEP process to figure out if they need speech therapy, if they need any type of social intervention, if they need behavioral intervention, if they need OT to help, if they have issues with handwriting, with ADLs, with all of those things. My son has an aide, he's in general education and has an aide as well, who helps him get out of the car because he has apraxia and has difficulty getting out. But otherwise, he can write his name and write a sentence. So again, also, like I said, there's these scattered skills that have to be addressed. It makes it can be quite difficult in the classroom setting.
So what resources or strategies can help parents become better advocates for their children who are on the autism spectrum? They don't know what they don't know. So what can they do?
So I often tell them to look at their Facebook groups, their social groups for parents of children with autism, and some of them are led by autistic adults. I think sometimes listening to people who have experienced things academically, socially, behaviorally can be great for them, because sometimes we may assume what is best for them, and then later on we find out that it caused a lot of distress. So I always tell people, let's just try to navigate it this way, by trying to listen to people who have experienced what they experienced. And then also, it's again, trying to make sure that your child is in the best situation that they're in through reading books about autism, reading books about children with behavioral problems, about learning. All of those things can be very helpful.
I'll add there also, I agree completely with Dr. Holler, particularly with sort of the Facebook groups and the communities of families who've been through this in your area, because, it's hard, but particularly access, right? Building a team, trying to access these services, as Ralph mentioned, you don't know what you don't know is hard, and it's overwhelming, particularly when you first receive a diagnosis and then on. And there are some resources, for example, the First 100 Days kit made by Autism Speak, the Autism Treatment Network. That's something you can Google and search, and kind of gives some sort of information on when you first receive a diagnosis, which is helpful for some people. Another thing is that, access can be hard to certain providers, but getting a good team together, right off the bat, a pediatric neurologist, a developmental behavioral pediatrician, a child psychiatrist who's in this space, what we call a higher level practice provider, asking your pediatrician for that referral right away, because those individuals can help you navigate some of the resources in the community. And then the last sort of one I'll touch on, because I work so closely with them here at UCLA, this sort of University Centers for Excellence in Developmental Disabilities, or UCEDs we call them, are entities that sit at a lot of different academic universities. They're federally funded, but one of the main goals is to be outward facing to the community, to help disseminate research to the community, hold lectures that are more community applicable, and maybe Google searching, if your area has one of those, you might actually find a lot of some of these resources there. Lectures, services for families or parents who've recently been given a diagnosis and to understand how to navigate things, access to research studies at local universities or local providers. And I know a lot of families in our area, at least in the greater Los Angeles area, that have benefited from that.
So thank you both. Those are all great ideas on how parents can better advocate for their children, and there seems to be a tremendous amount of resources out there for children and teenagers on the autism spectrum. But let's talk about the transition to adulthood. What are some of the key considerations for parents and educators when preparing a child or a teenager with autism for the transition to adulthood? Dr. Holler, do you have any thoughts on that?
If they are in the public school system, they're able to go to school at least until 21 and a half. So then that can be used as a time of transition. A lot of schools would provide programming on jobs, on trying to transition to college. In the Chicagoland area, so I guess it really depends on the area that you live in, there are programs for people 18 and above that can help them with trying to maybe even live independently. So there can be group homes. There can also be day programs where they can take you to a place where you can learn a skill. And there are also colleges that will give help to people who are transitioning to college. Even if you attend a university, there are many universities that have programs for autistic adults. Once you have that designated as a diagnosis, there are different things that the school can do in terms of accommodations. So there are different programs that are available.
Okay. So, you've answered a lot of great questions here. We appreciate the information. Dr. Wilson, I don't know if you have anything to add, but what I want to do is maybe hear from you. And then maybe we should look at some of the questions that have come in from the audience.
Yeah, and particularly on this advocating for the transition.
Yes, please.
Yeah, I agree very much with Dr. Holler. There's a lot of things in terms of support and thinking about the transition into adulthood. I think another sort of aspect of this is that there are state by state, for example, in California, for example, we call it the regional center, which historically many people think, and this is kind of under, government, funded, federally state funded also. There's many misconceptions that technically they do the evaluation from early birth to sort of 3 years of age. And once an individual starts in the public school system, they say, okay, that's on the public school system. But the reality is, with an autism diagnosis and certain criteria, you're a candidate for that state or funded research for quite some time, for a lifetime. And going back to some of those resources can be really helpful to start thinking about adult behavioral therapies, day programs if needed. Going back and asking for a care coordinator again, or requesting that again, I think are oftentimes that families come into my clinic, or families with adults that come into my clinic and aren't aware of. And so we try to get them reconnected back into those things that they largely thought were for young kids. The other sort of program that comes up from state by state in California and others is something called the self-determination program, or a program in which families are actually allowed to get training to understand what type of resources that they can access, or what are the best resources in their area, and they sort of get paid in order to access the resources that are best for their family. So rather than relying solely on referrals initially, they can get that sort of training on what's available in their area and then advocate for their autistic adult.
Okay. Well, thank you both. I'm going to stop with the questions, and let's go and see what our participants what's on their minds. We have looks like several really interesting questions in the chat. I'm not sure if you can see the questions, but I'll read them. The first question is, how is prevailing anxiety treated in adolescent autistic boys?
Yeah, happy to start. So first, and Dr. Holler, of course, please chime in as well, because I think there's, so when we think about, I'll kind of give this sort of first thought and answer to this, which is when we think about anxiety, even in autistic individuals, we are more often than not approaching it from a couple of avenues. One, behavioral techniques or therapies, if the anxiety is particularly stemming from things that might be more related within their autism diagnosis, right? High sensory over-responsiveness, really causing anxiety in certain situations, or they're about to approach a certain situation. We sometimes are trying to figure out, is a lot of rigidity, which is a kind of core aspect that we see in autism, is some of it also anxiety related? And from that standpoint, you want to be mindful of that in an autistic individual, because there might be certain behavioral strategies that you want to take beyond medication to help target some of these. The other aspect is we are often using what we traditionally think are medications for anxiety. These medications we often call selective serotonin reuptake inhibitors. Okay, so these are medications. The more common names that we say are Zoloft, Prozac, right, or sertraline, right, citalopram. And I'll mention those because those could be considerations for an autistic adolescent male with anxiety. But I'll note also what's important to consider is that in autistic individuals, we also know there can be higher rates of side effects to these medications. So having a provider that really understands that, who's going to be treating the anxiety and is able to look out for some of these side effects that we may not see as commonly in individuals who do not have autism, is also very important.
Thank you. Dr. Holler, if you don't have anything to add, I'll move to the next question.
You can move to the next question, Scott.
So how do you know if ABA therapy is the right choice for your child?
I'll discuss that. So I think it really should be considered if your child may have some behavioral challenges, excuse me, and you don't necessarily want to try any type of pharmacological intervention, especially for younger children. My son was an ABA for about a year, and it was very helpful in helping with ADLs, especially. They were great at helping with potty training, dressing himself. The reason why it did not actually help his language development was that we found that he had verbal apraxia. So he needed more speech therapy and a communication device. But otherwise, it has been shown to increase and improve cognitive ability, expressive language, fine motor skills, and in that aspect. I think that we should address that in terms of adult statistics do not necessarily like ABA. So if, as a parent, you were looking at Facebook groups or groups run by adult autistics, they will tell you that the ABA that they experienced, they felt was harmful. And I think that we have to understand what they had experienced, but not all ABA is the same. So I think that's something that they, as a parent, you should meet the BCBA, you should see how things are run, you should make sure that they're not trying to withhold things that your child desires, that they're not forcing your child to not STEM, or the objective is not for your child to be neurotypical, because they would be neurodivergent for the rest of their life, of course. So I think that the objective is not to be normal. It is to help them with some behaviors that may need help with.
So I suspect this next question, either of you would be great to answer this. Is there research around learning to play a musical instrument and improvement in behaviors with individuals with autism?
Yeah, I'm happy to start with that and then have Dr. Holler chime in as well. So, that's a really great question. Actually, there is some research around the use of musical instruments and music therapy or music programs to improve mainly, right, we're not necessarily looking at core autistic behaviors, although there have been shown improvements in using rhythmic drumming, for example, or other music therapy programs that have helped with social communication, helped with motor skills and executive function, like attention, for example, and also helped with fine motor skills as well. So I'm a big advocate of the arts used for neurologic conditions, both autism and even adult neurologic conditions. And so I think I'll just elaborate on that a little bit for that question, is that if you have providers in your area that lead some of these therapeutic programs, or frankly, even have programs that are right for your child or the individual that you're talking about. They don't necessarily have to be completely adapted to it, right? It can be another type of musical program. There's certainly, I think, an opportunity to engage in that and see maybe improvement in some of these areas. But also, what I'll just note really quickly is having some fun and some enjoyment. And I think sometimes it's easy, even for me as a provider, we come into the clinic visit and we say, okay, ABA therapy, occupational therapy, speech therapy. And there's a recognition that some of these really wonderful recreational programs can have these far-reaching benefits the same way that we refer them for neurotypical children. And there can be a lot of fun associated with it, which we all know can bring a lot of positive things to a child's life as well.
I wanted to add that in Illinois, there's a special recreation association. So usually by the time your child is 6, they can start learning a musical instrument. My son started playing the piano, and it's amazing. A lot of children enjoy music, and it calms him. His fine motor skills have improved. He's excited about going to piano. He just so much enjoys music. And I love that he's learning how to read music. So it's just amazing. So I think that is something that is offered to you as a parent and a child. You should definitely go for it.
Okay, so we have, I believe this is maybe a comment and maybe there's a question embedded in this, but I'll just read it and you can just respond to it. I'm an early intervention specialist with children birth to 5 and an evaluator for our programs. I think one of the best things parents can do is receive an evaluation on all domains. Even if the child only qualifies in other areas, they will have more professionals that could also help notice possible ASD.
Yeah, I fully agree. Yeah, with that comment. And I'll just note, I think for that point is that especially, sometimes what Dr. Holler mentioned earlier is that sometimes maybe at that moment, we're not seeing as much difficulty in that particular domain, but getting an evaluation right away or a baseline gets your foot into door to understand if other things come up over time. And then the other thing I'll just add to that is I do have a lot of families that come to me and understandably might say, you know what, I'm not sure if the public school system is right for my child because I'm worried they'll get lost, there's not the right support. And I fully understand that. But one thing that I often, and this is also individual dependent, is that, getting an individualized education plan or an evaluation from your public school system does open up the opportunity to even get therapies through the public school system, particularly, after 3 years of age. And it also offers an opportunity to get more evaluation on other domains as well, as the audience member brought up, which can be beneficial.
Okay. I'm not sure if you will be able to answer this, but can you please give more information on the state-by-state training programs for parents? And then there's a second part, and are there any resources to help with sleep in children with autism?
Yeah, I'm not sure I can comment on the state-by-state training programs. I'll let Dr. Holler chime in as well. I think it's hard to know state-by-state, but I do think having your pediatric, every state has early intervention services. Under the IDEA Act, every state has sort of generally a birth to 3 early intervention service and then goes on to either the public school system or some entity. And so going to your primary care provider, pediatric provider, if that's a medicine provider, and asking them about that or referral to that or information for that would at least, what I would suggest would be a start with that question.
And I agree with that. I'm not sure about state to state, but sometimes some states have like an ARC, that is, I think it's like, it's a national organization that helps with parents of children with disabilities. So that may be an option, but I don't know otherwise what is run in each state.
Okay, and the sleep, the question about sleep in children with autism. Do you have any thoughts on that, Dr. Holler?
Sure. So over 70% of children with autism have some type of sleep disorder, and often it is difficulty with either falling asleep or staying asleep. So I think the parents should talk with their pediatrician or neurologist about that to see if melatonin would be a good treatment, and also see if there are any type of behavioral changes that need to be addressed. Some kids can have difficulty falling asleep because they're anxious or because of sensory needs. So I think that's something that needs to be addressed per child to see exactly if there's an underlying reason for those sleep problems.
Yeah. There's also the, along with Dr. Holler, there's the Autism Treatment Network, or ATN, has created something called the Sleep Toolkit. And you can Google that also, a sleep toolkit. And they have several different kinds of sleep toolkits. They have one for younger children, they have ones for teens, and they have ones for those also on melatonin. And they're largely using behavioral strategies. And certainly there's many times where an autistic individual needs medication also. But I do think some of those strategies have been really helpful to a lot of my patients, and always employing or starting some of those behavioral strategies is a good first foundation as or before we're using a medication to treat the sleep as well.
As we getting close to the top of the hour, there's again just some incredibly helpful and thoughtful questions in the chat. But I thought we'd like to open it up maybe to live questions from the participants. Liam, is that part of the plan?
Yeah, we can do that if there are folks who want to ask questions live. You'll have to raise your hand and I can unmute you.
Let me know, Liam, if you're seeing any. If not, I'll continue with the questions in the chat.
Nothing yet.
Okay. Well, let's go with another question out of the chat. How do you advocate for an adult that has not been diagnosed with ADS, but struggles with some of the signs mentioned? They wonder why they don't fit in and don't recognize social dynamics when attempting to fit in. How do these adults find out how to navigate for some of the same resources that are available for children?
Yeah, so I think to start out, if this is an option, I do in those scenarios, we do have a lot of situations in our clinics where adults might self-refer for these same reasons that, there is something that's been harder. Work has been a little harder, social relationships have been a little harder. There are certain things that I'm starting to recognize that might be signs of autism, right? And I think in those scenarios, or when we have families and we diagnose children for the first time with autism, parents sometimes come and say, you know what, actually, when I think back on it, these were really tough things for me as a child, or these were really hard things as I became an adult. And I will say, I think my first comment is that, and hopefully this individual is open, I do think an evaluation is beneficial to really assess whether or not this is the diagnosis that might be occurring or they might be facing, because it does open up doors to understand what might be the best therapies or the best treatments or the best individuals to talk to, and make sure that we're knocking down the right door there, right? And so I think there are community providers that do evaluations. There are some academic centers that have adult clinics. And maybe that would be a nice first step, just to make sure that we're thinking about the correct diagnosis and then offering the correct therapies.
Okay, I'll try to get in a few more questions here. Um, would you recommend any specific evaluations when screening the siblings of individuals diagnosed with ASD? For example, genetic test. Also, are there resources available specifically for the siblings?
Yeah, that's I'll start and I'll let Dr. That's an excellent, very, very good question. So kind of starting that by, I think, point by point. So I'll start out. I'm a part of a consortium called the Baby Siblings Research Consortium, or the BSRC, which you can look up. And that is a consortium of researchers and clinicians that have been studying, sort of started out infants who have a sibling with autism to understand what are some of the earliest signs and symptoms. And that's from those studies that we got the information that if you have a sibling with autism, you're about up to 20% higher likelihood for having an autism diagnosis, but also up to about 20 to 30% higher likelihood of having maybe ADHD or language delays. And so you have a very good question, because the first one is, if an infant or a child has a sibling with autism, I think closer developmental monitoring and surveillance is important from the pediatrician to ensure whether there are signs and symptoms, and getting an early evaluation and early intervention. In most cases, we're not doing genetic testing right off the bat on that sibling if there isn't an autism diagnosis. But because genetic testing is recommended, or what we call the practice parameter or medical practice parameter for anyone with an autism diagnosis, if that sibling with an autism diagnosis does receive a certain genetic diagnosis, I do think it's important to talk to a genetic counselor as a part of that clinic if larger genetic screening or testing is needed. Okay. That same consortium does offer some resources for those who have a sibling with autism. And that's come up more and more over time, that recognition that siblings with autism, especially as they're getting older, throughout our research studies and through clinical studies, have a lot of questions about themselves, about their sort of family history. And so that consortium has some resources there. And I believe they have a link, or at least a connection, to a siblings group in particular, who are there for one another to talk about some of these things of having an autistic sibling as well.
And that's, excuse me, and that's what I typically do in clinic. If a parent says that I'm worried about my new toddler, then I would say, well, I would see the child, or that I would often refer them to early intervention, just to make sure that they've at least been evaluated and is followed closely by therapists.
Sorry, I accidentally put myself on mute. This is a fairly long question, so I'll try to read it slowly here. Is there any movement, possibly at the policy level, towards getting other behavioral therapies covered by insurance, i.e. Early Denver model, Jasper model, DIR floor time, Theraplay, pivotal response treatment, etc., so that those who don't feel standard ABA will work can get help for their child? It seems that the standard ABA STOT trifecta isn't always ideal.
Yeah. To answer short quick, I don't know where we're at on getting things like some of these more naturalistic therapies covered by insurance. What I will say, and to elaborate a little bit on that question, this is what we were talking about a little bit earlier, that ABA is kind of this umbrella term when we think about therapies. And the more naturalistic therapies like PRT, or pivotal response therapy, or Jasper therapy, which was created here at UCLA, which is joint attention, symbolic play, engagement, and regulation, created by Dr. Connie Cassery, are more of those kind of play-based therapies, with a recognition that understanding structured play is a very fundamental part of childhood that sometimes autistic individuals have difficulty with, and teaching those things and working on those things can help things like language outcomes, attention outcomes, things like that. So as of now, right, historically, at least Jasper is not covered under insurance. What I will say is that there are more and more ABA companies that we're seeing that are using some of those strategies, that are not using the sort of traditional DTT, although that's kind of the mainstay of the therapies, but they are starting to embed things like pivotal response therapy. Or I've seen more companies that have particularly a PRT specialist And so I think looking for some of those, or when you communicate with an ABA company asking about that, can be helpful to understand if there's providers that are trained in some of those therapies and employ them with the individuals that they care for.
A couple more questions here as we're getting close to time. What are your thoughts on heavy metal detoxing and autism?
I will say that that is something that has been debunked over time, that autism is not due to any type of heavy metal poisoning. So I do not do anything like that with my child, and so I do not recommend that for any child.
I agree with Dr. Holler. And I think one thing you want to be mindful of is that there's been, concerns with very bad side effects or, medical side effects with children who've undergone that. So I agree with Dr.
Holler. Let's try to squeeze in one more here, Liam, if you don't mind. Do you think that children with persistent hypermobility should be screened for autism?
Yeah. Go ahead, Dr. Hall.
Hypermobility is so common. We see it so frequently in children. But I have to say that when I evaluate my autistic patients, quite a few of them are hypermobile, including my son. But I'm also hypermobile as when I was younger as well. So it's one of those common things. And can we put it together in terms of a comorbid or coexisting condition? It's possible, but I don't think that every child who's hypermobile necessarily needs to be evaluated for autism. But I think it's something that the pediatrician can observe over time and then see if any other type of issues like social communication or repetitive behaviors are noted.
So there's a question here. It's a bit fragmented, but it'll probably make sense to the two of you. It says connection with hypermobility and possibly connective tissue disease.
So let me take a look at that and see.
It's towards the top, the third one from the top.
I think it was the same thing about heads in terms of hypermobility and Ehlers-Danlos.
Yeah, I agree with Dr. Holler. I think it's sort of that same connection of these higher, or, these kind of often coming together where we're seeing more individuals, maybe with Ehlers-Danlos showing autism symptoms or autistic individuals showing hypermobility. Their, hypermobility and connective tissue disorders can go together, which is a different sort of genetic or entity, not necessarily always associated with autism.
Okay, so we are, it is 7:59 Central. So I suspect we should wrap up. Again, I just want to thank Dr. Holler and Dr. Wilson just for the great information that you shared. I want to thank the participants for your thoughtful and helpful questions. And thank you for joining us. Just a quick commercial here. The American Brain Foundation hosts free webinars regularly, and we'd love to see you again. The next event will be on September 19th with Dr. David Doddick and our 2024 class of funded researchers, hear directly from people whose work your donations support. You can also follow ABF on social media to stay up to date on brain disease, information, and research. I invite you to visit the Brain and Life website and listen to the Brain and Life podcast. Brain and Life is the official publication of ABF's partner organization, the American Academy of Neurology, with information on resources to help us keep our brains healthy. Lastly, you can support innovative research to find the cures of tomorrow by making a donation to the American Brain Foundation. No donation is too small. We like bigger ones, but none are too small. And every gift will be doubled thanks to a generous matching donor. ABF cannot do this work without your support. With that, thank you and good night.
Thank you for having us.
Thank you.
Good night.
Night.